Okay, good evening, everyone. Good evening, everyone, and welcome. My name is Emma Fabian, and I'm the Associate Vice President of Harm Reduction at Evergreen Health here in the western part of New York State, Buffalo. Shout out to everybody on from Buffalo that I see here, and the Jamestown area. I'm also a member of the Executive Committee of the New York State Harm Reduction Association. Couple words about the New York State Harm Reduction Association that's hosting tonight's discussion. The New York State Harm Reduction Association, or NYSRA, as we call it, is a statewide organization that works to advance the scientifically based success of harm reduction treatment, practice, and policy. You can learn more about our organization and our work at nysra.org. That's NYSHRA.org. And we are always looking for new members. So check that out if you haven't already. It's really an honor to be moderating this emergency discussion on a couple very important legislative issues that impact our harm reduction community this evening. For us here at the New York State Harm Reduction Association, it's important to not only advance harm reduction interventions in substance use treatment and public health, but it's also critical to be educating our members and the community about policy issues that impact the populations we care about, and in many cases, the populations we serve, and real ways that we can all take part in change. With that being said, the New York State legislative session ends on June 10th. That means that as of today, we have just a handful, like 6 days left in New York State to get bills turned into laws. Hence the word emergency in tonight's event title. So the primary issues we're talking about with our panelists here this evening are: one, creating an opioid settlement fund, and two, syringe decriminalization. So opioid settlement fund and syringe decriminalization. Neither of these really important issues has been settled thus far in the legislative session, and we didn't want this session to go by without taking a little time out to talk about why they're critical issues for the harm reduction community and what you can do to help today. So we're going to end by talking about ways that you can get involved. I have some prepared questions for our panelists this evening that will go for around 45 minutes. And we're also going to ask them some questions from the audience if folks that are joining this evening from around the state have any questions. And if you do have questions, you can use the chat box at any time to submit those questions, and we'll probably get to them at the end. And in addition to questions, feel free to just put in the chat your name, where you're from, and so we can just know about all the amazing areas across the state that people are calling in from. So I'm going to move into introductions at this time because we're going to try to use the hour that we have together really well. And so first of all, thank you so much to our panelists for joining us during what is an extremely busy time of year. We don't take that lightly that you chose to spend an hour with us talking to potential members of the New York State Harm Reduction Association this evening. And so I'm going to share the name and titles of our panelists, and I'd ask you to share a couple sentences about your work and your organization, if that's okay. So let's jump right into it. I'd like to start out by welcoming the always powerful and advocate whose work I've been following for several years now. So it's exciting to have her part of the conversation. And that's Tracy Gardner, Vice President of Policy Advocacy at the Legal Action Center. So Tracy, if you wouldn't mind sharing a little bit about yourself and the organization where you work.
Sure. Thanks a lot, Emma, and thanks New York State Harm Reduction Association. It's wonderful to see the beginnings and the existence of this organization. I've been working in Albany as a policy advocate, organizer for more than 30 years. Each legislative session, happens every year. They're never the same. And my role at Legal Action Center is just kind of the traffic cop of all of the policy issues that we work on that have to do with people who are dealing with substance use, people who have criminal record issues, criminal history, and HIV. So again, just really appreciate being asked to talk about this end of session issue or end of session issues. And if I could just turn it over to my colleague, Christine Kaiken.
Sure. Thanks, Tracy, and thanks, Emma, for having me. I'm Christine Kaiken, Senior Health Policy Attorney at Legal Action Center, lucky enough to be Tracy Gardner's protege. I saw her roll her eyes, but it's true. I've been at Legal Action Center about 2.5 years, and I focus primarily on policy issues related to substance use disorder, treatment access, insurance coverage, harm reduction, also health privacy. And yeah, I'm just, I would just echo Tracy. This is my 3rd legislative session at Legal Action Center, and it's never the same. And the things that we think are going to be the big issues end up being something else, and we just get caught up. And right now, I'm glad to be having this discussion because I think these are really huge issues that we're hoping to spread the word about and get people involved. So thanks again.
Thank you so much, Legal Action Center folks. And I'd like to move on to a very powerful organizer who I've gotten to know over the past year or so, doing a lot of work across the state on during this legislative session and all times of year, really. Biz Berthy from Vocal, New York. Would you mind introducing yourself?
Yeah, thank you. Thank you, everyone. Thanks for having me. My name's Biz, as Emma just said. I'm the drug policy organizer here at Vocal. And just for those of you who may not know what Vocal is or who we are, we're a statewide membership-based organization, and we organize around 4 main issue areas. So ending the war on drugs and the overdose crisis, ending HIV and AIDS, mass incarceration, and homelessness. And then under each of those issue areas, we have a union made up of directly impacted people. And we work with those folks to do various forms of advocacy and leadership development. And then Vocal also has a direct services wing in downtown Brooklyn. We have a syringe exchange program where we've been around for about 20 years, and yeah. And I organized, I told everyone before we started this panel that my mind is like getting oriented to the week because of the long weekend, so sorry. I organize for the Users Union, which is the union that focuses on ending the war on drugs and the overdose crisis.
Awesome, thanks, Biz. And I've been dreaming about the day when I can return to the halls of the Capitol building with the Users Union members and Biz and everyone else at Vocal. So that day will come, I hope. Biz, I'm actually gonna jump right into the discussion about syringe decriminalization, if that's okay with you. Some of the folks joining us this evening probably have some exposure to this issue. I'm calling in from the back of a syringe exchange program where my office is in Buffalo, my syringes and Narcan that are always next to my desk. So this is an important issue for me, and I know a lot of the people that are on tonight's meeting. Can you give us an overview of this syringe decriminalization issue in the state right now, and talk a little bit about what the proposed legislation is that we are coming together this evening to talk about?
Yeah, absolutely. So this bill is really sort of like the final iteration of several bills that have come before this that Tracy and Christine have worked on far before my time at Vocal. But specifically, this bill decriminalizes syringes And it also expands access to the amount of syringes that folks can get at pharmacies at this time by removing the ESAP limit. So currently, people can only get 10 at a time, which can be very limiting and just really inadequate for many people. And this bill is really, it's always been needed, but I would say it's more critical than ever, just because if we saw during COVID, and I'm sure many of the attendees on this panel have witnessed firsthand, being service providers, what happens, right, when people don't have access to sterile syringes. So as some of you may already know, Governor Cuomo cut funding to critical harm reduction service providers during COVID, and also cut funding to the manufacturer. So it created a syringe shortage across the state, which was very alarming. And pretty quickly, we saw that HIV rates have gone up, Hep C rates have gone up across the state. Specifically, there's a new HIV cluster in Monroe County. And this is alarming for many reasons, but I think it's also just, it's unacceptable for this to be happening in 2021, especially considering the fact that, Governor Cuomo ran on a platform to end AIDS by 2020. And we were getting there. We were definitely like leading in terms of the nation, but we are going backwards, and we're going backwards very quickly. The other reason why this is a critical bill is, like, I think as many people would already agree, we just shouldn't be criminalizing people for a public health tool. And time again, we've heard our electeds, say, like, we can't arrest our way out of the overdose crisis. We need to treat this like a public health issue that it is. And yet in 2021, I know I keep saying that, but I think it's critical, people are still getting arrested for simple syringe possession. And that may not happen as frequently in New York City areas, but I know that, for instance, folks at Evergreen have spoken frequently about being arrested for syringe possession without even any, to be clear, without any residue or anything like that in the syringe, just a sterile syringe. So it's really about time that we finally pass this bill, especially considering the fact, of course, that, like, the state pays millions, as they should, millions of dollars to syringe exchange programs across the state to distribute syringes, which they, openly recognize as an effective public health tool. But at the same time, we have the criminal code suggesting otherwise, and we just can't be having mixed signals right now when it comes to drug user health. And this is also really an overdose prevention bill. It might not seem like it at first, but we know that people exiting incarceration are at extremely high risk of overdose. It's actually the #1 cause of death for folks that leave within the first 2 weeks. So that's, we need to stop. We need to, like, break this cycle of, like, incarceration, specifically around these public health matters. But yeah, that's pretty much the basic overview of what the bill does, and I think why it's critical at this time.
Awesome. Thank you so much. We're going to kind of come back and probably ask you some follow-up questions about syringe decriminalization, hugely important issue right now. I'm going to move on to Tracy and Christine, if that's okay, to see if you can provide a similar overview of why we're talking about the creation of an opioid settlement fund today, and what, maybe if you can delve into what the proposed New York State bills right now that have already been introduced are.
We're gonna tag team this a little bit. I just want to kind of set a stage, because it's definitely been my experience that in the final days of the legislative session, sometimes it's called the big ugly, sometimes it happens during budget, but there are a bunch of issues that are either controversial or just difficult to get unanimity on in the respective houses. We've got a very different political landscape to be having this discussion, and including, a different role that the executive has, and also, power changes, power dynamics in the Assembly and with the Senate now having a veto-proof majority. So the issue really is about like a national national activities that are happening around attorney generals in different states suing prescription painkiller manufacturers to hold them accountable for the, you know, hundreds of thousands of deaths due to overdose and for people becoming addicted to opioids. What's important though is that, and why it's so important for the harm reduction community, is that the this is not about addressing just prescription painkillers, and that this is about addressing the system that we have developed to address people who use drugs or people who struggle with drugs or people who have health risks from using drugs for the last 40 years, if not more. And so if anything, the prescription painkiller epidemic simply fueled more of the fracture of an already fractured system made up of substance use disorder treatment, evidence-based, sometimes not evidence-based, harm reduction, responding to risk of bloodborne diseases. And we just really want to ground that understanding. Like, this is not something off to the side, right? In as much as we look at cannabis legislation and how that is addressing, or it's built into the new legislation to address communities that have historically been harmed by the criminalization of marijuana, of cannabis. It's the same thing here in terms of the settlement, as far as I'm concerned. And I think that other people see that those dollars are not kind of spent willy-nilly, that they don't go the way of tobacco settlement funds, right? We learned a lot about what not to do with that, and that there's an understanding that there is a need in the midst of our overdose epidemic, but also to build a treatment system that would have prevented a lot of the overdoses had it been more effective, more accessible. And we can't ignore the fact that we have been living with a treatment system serving Black and brown people and just fine with it being broken and arm in arm with the justice system. And with the quote unquote changing face of the overdose epidemic, we now see how broken it is, but it's always been that broken. So any resource that comes into the state that is going to address the needs of people who use drugs and keeping them healthy is our money. And that's really, I think, kind of the message that needs to be sent as we talk about next steps and messaging to the legislature. But I am not an attorney, and I get nauseous when I read legislation. So I want Christine, who has really been literally like writing law and addressing a lot of the concerns from the community in working with the legislators working on this, she can walk us through the real key components of the legislation.
Well, thanks, Tracy. Yeah, I think that was really helpful to set the stage. I'm gonna kind of talk about, so as Emma said, there's two bills right now, which is sort of a political issue. So what's been going on from that standpoint is we have a Senate bill from Senator Rivera from the Bronx, chair of the Health Committee, seems to be the Senate bill that's really moving forward. And then in the Assembly, there's kind of two different bills, one that is the same as Senator Rivera's bill, and then a different one from Assemblymember Warner. And so the issue right now is that these bills are pretty similar and kind of reflect a lot of what I think is really important to the advocates. I think one thing that was really important to us when we started working on this really last year, but in earnest several months ago, is to make sure we accomplish what Tracy just mentioned, which is that just because this is money coming from like the opioid manufacturers and the pharmaceutical distributors, we don't want that money to just address prescription opioid addiction. It's meant to address the historical issues, the problems with the treatment system. And so that's really what we've been focusing on. But and I'll go into that a little bit more, but there's kind of three main components that are really important about this legislation. So the first is the creation of a dedicated fund for these dollars. So they cannot be used for anything but supporting and enhancing services for people with substance use disorder, co-occurring condition, people who are in recovery. So we're talking about huge amounts of money, potentially millions and millions, possibly $1 billion coming into the state from these settlements. And it's still unclear exactly how much and the timing of these things, but the dedicated fund ensures that this money, that's what it's for. And so that's been kind of like key component number one. And second, in companion with that, is we don't want to get this large chunk of money and then have it just replace existing funding for the services we already have, which, as Tracy just said, and everyone on this call knows, are already really inadequate, underfunded. So the bills have language to make sure this is a supplement to existing funds, so enhancing existing services for prevention, treatment, harm reduction, and recovery, and creating new services where needed and expanding services where needed, so that, you know, we're not just supplanting or replacing existing funds. And then the last key component is creating an advisory board that would make recommendations about where funds should go, and that it's been really important to us that that advisory board is made up of people with personal and professional experience and reflects the actual needs of the community, including Black and Brown individuals and others who've been really underserved by the existing treatment system. So those are the main components that we're looking for in a bill. And I'll be honest with you, right now, I think where we're at is that the Senate and the Assembly just really need to come together on like the last remaining details, so that they're passing the same bill. We have, as Emma said, 6 days left. And there's a little bit of an issue between the two houses, and we really need to pass the same bill. And the reason we need to pass that bill by this session is because the money could be coming in very quickly. In fact, there's already been one settlement that happened earlier this year against McKinsey, which is a consulting company. They were advising Purdue and other companies on sales strategies of how to sell, you know, the highest dose opioid painkillers. And the state received $32 million, and 22 million of that went and ended up going to the state's general fund. And so this already happened. We already lost access to a big chunk of settlement dollars. The governor, I think, said in a press conference, you know, it's still going to go to services, but nobody has heard anything about that money since. So the need for this legislation to actually direct the money is critical, and critical like this session, because money is going to start flowing. It already has started flowing and we lost it. And so a lot more money is going to be flowing very soon. Settlements are being finalized pretty quickly, actually. So yeah, so those are the components of the bill. You know, we also have really stressed throughout that it needs to go towards comprehensive services for prevention, treatment, harm reduction, and recovery throughout the state. So that's these are the, you know, that's kind of just the nuts and bolts, I would say, of the legislation right now.
Wonderful. Thank you for breaking that down. I mean, I think that I alluded to this in the introduction, but for a group of, I know that people that join our New York State Harm Reduction Association calls and educational sessions and conferences, in many cases, work in substance use treatment, and in many cases, actual harm reduction service provision. And for me, this has been an issue, the opioid settlement fund topic, not extremely widely covered and in a way that is possible for us to digest. And as you mentioned, Christine, we're talking potentially tens of millions of dollars. Some of my colleagues have said, we had to furlough folks. I know there's folks that are on the call this evening who had to furlough their staff. And so this could mean the difference of either being able to provide life-saving services or not being able to provide those services. Can I just circle back to one thing that you mentioned, Christine, just to emphasize the point? If the Senate and the Assembly don't pass same as versions of a bill, what happens on June 10th when the legislative session ends?
Yeah, so what happens is we have no law. So there's nothing for the governor to sign, and we have no opportunity to ensure where these funds go until next year, which is probably too late because, as I said, it seems very likely that a lot more money could be coming even this summer into the state. And we already saw well, first of all, we saw what happened historically with the tobacco settlements, as Tracy mentioned. So that money was supposed to be, that was a substantial amount of money supposed to be used for health, smoking cessation, other issues, and most of it disappeared. I mean, it's like it literally disappeared, and that could easily happen with this money. I think that a lot of people on this call know that even though the governor said in some press conference that he still wants all this money, even though it's in the general fund, it's still going to services. I think, we know historically that's not likely. Has not really been the priority for this governor. So I think, the real risk here is just losing that money, not knowing where it goes. And so we have 6 session days to get the two houses together. I saw a question in the chat asking what the disconnect is. I think that's a really good question. I think some of it is maybe just political. Some of the different issues in the bill, as I understand, are probably going to be amended. But for one thing, the Senate has been working for a long time with the Attorney General to make sure that the Senate bill aligns with the settlements, because the settlements are going to include some language that directs money in certain ways. And if the bill is too different from the settlement, you're not going to be able to direct that money. And so I think what we're seeing now is that the Assembly bill didn't necessarily do that in the same way. They had not been working with the attorney generals, but it's my understanding that they're starting to come together on those points. And that's a lot of the advocacy that we're engaged in right now, honestly, is not necessarily the substance, but trying to get them to just agree. As long as we have the components that we want, we just need to get that alignment.
Yeah, I would just add that it's an unusual bill in that generally the Attorney General is not a stakeholder in the legislative process. And so, and then of course the politics of that with, Tish James and the governor, and, she's kind of the second most important Democrat, in the state in that sense. So that is, kind of a thing that they are navigating. The other thing is that next year is an election year. So generally during election year, controversial issues don't get done. And although this would be a great bill for people who are running, who are, especially those who are being primaried, to be able to say, oh, I helped bring settlement money to New York. But definitely during an election year, less is done rather than more. New York legislation has 2 years, so it will still be in play next year. But again, if there's not a same as, and they pass like 2 ships in the night, each house passing their own version, then there's nothing to to send to the governor to sign. And again, we can't and shouldn't wait. And there is definitely, even though it's only 6 or 7 days left to the session, this is also crunch time, and trying to elevate this issue above all of the different competing interests is going to be a challenge. But Legal Action Center is working on another issue having to do with clean slate and expungement and sealing. And that's an issue that has definitely percolated to the attention of legislators. So it is possible. And I guess when we talk later about getting the message out and how it needs to be a constant drumbeat so that no one can say they didn't know that there was community action around the opioid settlement.
Awesome. Thanks for breaking that down, Tracy. Since Tracy mentioned clean slate, I want to move to Biz and see, Biz, if there are any actual wins already out of this legislative session that the harm reduction community or folks on this Zoom meeting would like to know about. And then I'm going to ask the same of Christine and Tracy.
Yeah, so just last week, the MAT and Prisons and Jails bill, which I think Vocal and LAC have been working on for at least 3 or 4 years, finally passed out of both houses. It passed out of the assembly last week. So that was very exciting. Obviously, we still have to get it to the governor's desk, but for right now, we're taking a victory lap of sorts to just sort of relish a win for once. But basically, so for those that don't know, this bill its intent is to mandate medication-assisted treatment inside all New York State prisons and jails. And really the most critical aspect of the bill is getting that in for county jails, just because counties are kind of strapped for cash in the way that like states aren't, like state prisons aren't. And the bill does 3 critical things. So first, it offers all 3 forms of, it mandates that folks are offered all 3 forms of MAT, so buprenorphine, methadone, and Vivitrol. And then, of course, that people are able to access that at any point during their incarceration without any kind of retaliation from COs. And then the final aspect of the bill that I think is like really the most important is the kind of like warm handoff to the community. So when, like I said earlier, with Syringe Decrim, so that way folks who are exiting are able to make sure that they have access to their MAT, continued access. And we know that, of course, that's really important because those 2 weeks after people leave jail or prison, it's a really critical time in terms of overdose prevention. So this bill, which has been in various forms enacted in other states, has been shown to have like really, really positive effects in terms of lowering overdose rates. So it's really exciting that we got this passed in both houses. And I don't know, Tracy or Christine, if you have any other big wins.
I was going to say the same, Bill. So
I know that's the big one. It is definitely the big one. And, you know, just the history is sometimes helpful. What Biz, you pointed out is that this decrim bill is kind of the last piece of New York's infrastructure around expanded syringe access. And this has been in place, the larger bill, since the man who defeated Andrew Cuomo's father came into office. So with a Republican governor and a Republican dominated Senate, we were able to get a huge chunk of legislation passed that acknowledged the health risk for people who use drugs and who needed a clean syringe every time. And so this is this last undone piece. And the resistance to it, let's just say that there are some people who seem not to know that it's 2021. There are some people who seem not to know that the case has been made scientifically about the effectiveness of syringe exchange. and clean syringes in terms of reducing bloodborne diseases like HIV and Hep C, and that they're still of the mindset that making the syringe available, just like when we used to talk about condoms, will encourage more drug use. And so that's really unfortunate, because that's kind of a willful, not a willfulness and not acknowledging that the science has refuted that. You know, I would say the other piece about people who are at risk for arrest, who are just carrying syringes, not even with residue, some of that has to do with educating law enforcement. And back in the day, the AIDS Institute actually had resources to dispatch and work with law enforcement about syringe exchange programs, about people with syringe exchange cards, about the need to be able to safely, you know, travel from one place to another with a used syringe. And in that case, education really worked, but the AIDS Institute has been whacked so many times to the bone in terms of funding. And then they were almost completely embroiled in COVID, that they weren't really able to do all that a lot of us have seen the AIDS Institute be able to do in terms of drug user health. So that's all the more reason that we need to have more clean syringes and a better understanding by everyone in the public health realm, including law enforcement, that this is the way that we keep from having new HIV infection clusters, new Hep C infections, and just to be able to prevent these diseases.
Yeah, and I will add that actually there are like coalitions of former law enforcement and police officers just that do support this bill. So I think that's also, just to add on to what Tracy was already describing, I think that's another sort of frustrating aspect in terms of getting this bill finally across the finish line, which people have been fighting for like over a decade, is that, you know, law enforcement is advocating for it. And then we saw, as Tracy just named, that the bill made it farther than it's ever currently made itself go in a Republican controlled Senate. So it's been a very frustrating fight. I think I'm hopeful that we're going to get it over the line in these last sort of 6 days, as Emma said in the beginning. And then someone, I think in the chat, had asked if there was any protection in terms of if a program participant showed their ID card to law enforcement. Theoretically, yes, but I think, and Emma, I think you can probably speak to this more than I can, just because, like I said before, these arrests, aside from Long Island, don't necessarily happen a ton in New York City, but we have been told many times by various participants, especially in more rural and upstate areas of New York, that they'll show law enforcement their SEP card, and sometimes they'll literally throw it. Like that's not an uncommon thing. So I think what we really need to be focusing on is just removing it entirely from the penal code, so they can't do that anymore. And then the other thing, someone asked if for the medication assisted treatment inside prisons and jails bill, if it mandated naloxone distribution, or like distributing naloxone to people who are exiting their incarceration. I don't think that this bill addresses that. I do think that's a good idea. However, I will say, I think this bill sort of goes even farther in terms of prevention, right? Because it's like, naloxone is, you know, it's a miracle drug. I think we can all agree on that, but it's something that you use like after someone has overdosed. And so the idea with medication assisted treatment is that, you know, many studies have shown that it cuts down overdose rates by more than half in some cases. So that's why we really push for this one.
Although there is programming in the state prison system to provide naloxone to the corrections officers, and in certain instances of their discharge planning unit to people leaving. Yeah.
You know, Biz, one thing just to add to the conversation about MAT and especially county jails is, I think although the Senate and the Assembly have approved these bills, the advocacy probably isn't over by any means for people who care about these issues. You know, I'm calling in from Erie County, and I know there are some other folks on the meeting who know about the pretty egregious conditions in our county jails. And so this is really just the beginning of making sure that we provide access to life-saving medication in our county jails for a lot of us here in New York State. Would you agree about that?
Yes, absolutely. And I think also the MRTA bill and like its subsequent implementation is like a really good example of how even, I mean, we should all celebrate these wins, especially MAT in prisons and jails, but you can't ever get too comfortable. It's definitely something that you always have to keep an eye on in terms of implementation, because again, unfortunately, because of like what you were talking about, Erie County Jail, like we've been showed that like people can't necessarily be trusted to sort of implement this in like the correct way, and obviously in a way that like upholds like the dignity and humanity of people who use drugs.
I also want to add on that point, you know, as some of my colleagues at LAC who litigate on the issue of people being denied medication, it's basically already law, because this is already required basically by the Americans with Disability Act. You know, refusing to provide medication is really a violation of an individual's right. And they still do it all the time. And there's a lot of litigation on this point. So I think implementation is going to be really important. And another piece of implementation is funding. There's a teeny amount of money, which is more than there has been in the budget this year for this bill to provide to provide this medication, but there's going to still need to be a lot of advocacy if and when Governor Cuomo signs this to get adequate funding to support these services.
Thank you. So one of my final questions before we see if there are any lingering ones in the chat box, one of my final questions was going to be if, you know, from a harm reduction perspective, if folks think that the status of these bills suggests or tells us anything about our values in New York State right now. And Tracy kind of delved into answering that question. Biz, I don't know if you want to add anything to that. What the status of the syringe decriminalization bill says about our values in New York State.
Well, I think that people are often beholden to a lot of sort of political forces that I think personally, I would hope that they would not sort of like submit to. But more than that, I think Decrim is like a really good example, and I've talked about this too when it comes to methadone access, is that really there isn't any reason, especially again, when you have theoretically a more conservative sort of group of folks like law enforcement who support the bill, rightfully so. There shouldn't be any reason why Senate leaders and Assembly leaders don't pass this bill. And so that often leads me to believe that like people are just, they cling to stigma around drug use and just stigmatizing people who use drugs. And that really just becomes like one of the singular reasons why a lot of these bills don't get passed, which is really frustrating, just because I know advocates across the state, and then of course, like the leadership of the UU has spent specifically with this bill, like the past decade, trying their best to educate these electeds and trying their best to even educate their constituents. And I think also what frustrates me personally with syringe decrim is that I also don't think that this is a bill that even like a theoretical, more conservative constituent base would be aware of passing. It's not something that's even like as obvious as a sharps disposal box, right? It's not something that like tangibly or physically sort of interrupts people's days. It's not like the same as erecting an OPC. Those are more complicated fights, but something like syringe decrim could pass, and the only people that would know about it, of course, are the people that are in desperate need of it and have needed it, right? Like that's another frustrating thing, is that it's just sort of a retroactive bill. It's in many cases, again, with the HIV cluster in Monroe County, if we had had this bill passed, people might have been able to access pharmacy syringes when there was a syringe shortage over the past year, and we might not be looking at the same numbers in terms of HIV rates and Hep C rates. So for me, I think it's really a reflection of our sort of society's reluctance in sort of finally relinquishing stigma towards drug use and the people that use drugs.
Thanks, Biz. Yeah, here at Evergreen, we believe that it would bring more people into the syringe exchange setting for equipment, for Narcan, for a passageway into counseling, treatment, primary care, specialty care, community. So really putting a lot of good vibes, energy, calls to action, which we're going to get into here, into getting these bills passed. I want to see if Naomi or anyone else who's helping out today from the New York State Harm Reduction Association sees any questions in the chat that we haven't addressed yet.
See, I'm scrolling through. This may have been touched on earlier. I see Valerie was asking about specifically the opioid settlement fund question about what's the contention between the bill in the Senate and the Assembly. I think maybe that was touched on, but was there any other thoughts on that point?
Yeah, I think I didn't go into that much detail. I think, as I said, I think the bills are getting closer and closer together, which is great. There is one sticking point that we've been hearing, which has to do with how the money will be allocated. So the Assembly bill in the Assembly seemed to support having the legislature allocate the funds and make the funding decisions. The Senate bill has the executive, really like Oasis, in partnership with other state agencies, making those decisions. For us, I have to say, I guess I don't love necessarily the legislature making those decisions, but I think as advocates, the really important piece is, all the other components of the bill. So we just want, really the two houses to come together on those pieces. I honestly can't tell you which way they're going. I'm not exactly sure, but that's kind of been, as I understand it, like the biggest battle point. And then some of the other things, frankly, are just sort of technical kind of language issues. I think we've spent a lot of time working with the Assembly to get a lot more in there that would support things like harm reduction and recovery, which was not as in there before. It was really more focused just on treatment services. And that's, they've been really like open to those changes, which is great, which is really refreshing. So that's kind of, this sort of like who's making the final funding allocations decisions is really the big sticking point.
I would add, as the old lady on the scene, that at least in my time in working in Albany, Oasis, the state addiction agency, was the stepchild, and they almost never got a lot of money except through federal block grants, very little state funds. And the whole idea of funding an addiction agency was just very low priority. And so that, couple that with, this is the state agency that was built around New York's experience with its first heroin epidemic. And I would say this in public, this is not, I don't think this is gossip, if you will, but the Assembly, especially the caucus, doesn't really trust the executive agency to fairly get the money out to where it's most needed. And again, that's kind of historical experience. It, again, our first heroin epidemic got mandatory minimums. How we responded to crack, obviously different. So you do, I think it is safe to say though, that there are some in the assembly who have concerns about how the money is distributed, and that's being heard by assembly leadership.
Thanks, Tracy. As soon as you said you would say this publicly, I was like, oh, what's she gonna say? But yeah, thank you for adding that context. So we are closing in on our 60 minutes together here. I just, thank you again so much, Biz, Tracy, Christine, for spending this time with us. I know we all, we feel that these are really critical issues that might, I think there were definitely some folks that joined the meeting this evening who probably learned a lot. I know I did. And hopefully this is a continuation of us talking about these critical policy issues more and more in the harm reduction community. We're going to move into talking about action items, what the folks have joined us this evening can do in the next 6 days to act on the opioid settlement fund, as well as syringe decriminalization. And this talk's being recorded, of course. And so there could be some folks watching in the coming days that want to get involved. Biz, can I start out by saying you have an example tweet or a sample tweet that I know I'm going to tweet out this evening. Is that something you can talk about and potentially share in the chat box?
Yeah, so I think it's really all about what Tracy was saying just a moment ago about like keeping the drum beating in these last sort of final hours of the session. And again, just like the purpose of that is to remind so that they can't later on say that they didn't know, and to also fight back against this idea that this isn't an issue that their constituents would care about, or that's an issue that affects people across the state. So that being said, our call to action is just for people to, I think that you had shared a call script, right, for Speaker Heastie and Majority Leader Stewart Cousins, calling their Albany offices just to say, you need to pass this bill for X and X reason. And then I went ahead and I made up some tweet templates so people didn't even have to think about what to tweet. You can just tweet it out. So I'm going to drop that in the chat. I think it speaks for itself. There are two options. And then if people also want to share that they took action, like on Facebook, I also have a Facebook post template for people to use if they're Facebook users.
Thanks, Biz. I will say, and you've heard me talk about this before, earlier this year in 2021, myself and some of our members here in Western New York started tweeting at some local assembly members and senators. Since then, one assembly member and 2 senators, Tim Kennedy, Sean Ryan, and John Rivera out of Western New York, never before really been part of conversations about harm reduction, HIV prevention, hepatitis C prevention, overdose, substance use treatment in general, not something that they tend to be real involved in, had meetings with us and have co-sponsored that bill. So this session, in my experience, actually doing some agitational / educational social media, reaching out and contacting those offices has proven to work on this issue for us. And so I just wanted to share that. And Naomi, are we able to share the script that we have right now, specifically about decriminalization?
I can't do it, unfortunately, at this moment, but I will send an email out tomorrow morning with what Biz just shared, as well as some other, what you're just talking about, a script to use if you will be contacting these legislators.
Awesome, thank you. So sounds like tomorrow morning, folks will be getting a script to contact their the leaders and legislators about syringe decriminalization, as well as creating the opioid settlement fund. It's really easy to take part. You can either copy and paste the document and send it by email. You can also just take 1 minute to call the leaders and say the script over the phone. It literally, if you call both leaders, it takes probably that 2 minutes. You could also choose to call your local assembly member and senator, which will take an additional 2 minutes. So hopefully you can set aside some time to do that tomorrow morning. And I know I will be probably every day for the next 9 days. I'm gonna even call on the weekends. That's what I'm gonna do. So those are our calls to action. Just the next 2 minutes that we have here, I want to thank Biz, Tracy, and Christine again so much for your time, for your tireless advocacy on these incredibly important issues. I say that from the bottom of my heart. And I want to know if you want to just add anything in the final 2 minutes here about action steps that folks can take.
Just reiterating what you said, there's going to be so much noise as we barrel to the end of the session, and keeping this elevated and on people's minds and in their inboxes and across their platforms is going to be critical.
Yep, same messaging here. And then I know that there was a question about connection to safe consumption sites, and we can't sort of dive down that rabbit hole, but I will say that, like, I think it's a good illustration of how all of our issues are connected, right? Like opioid settlement funds and syringe decrim and OPCs might not seem connected at first, but a lot of the things that we're talking about cost money. And as we've seen time and time again, harm reduction services always are scraping the bottom of the barrel in terms of funding. So I will put my email in the chat because I'm happy to talk to any of you anytime to talk about sort of those connections, because I think they're really important.
All right. Well, again, thank you so much. Good luck in the final days of this session. And yeah, thanks everyone for joining us this evening. And don't forget to make just a couple phone calls, send a couple emails tomorrow. It's going to go a long way. I really can promise you that. It's your contacting folks is going to go a long way this session. So thank you, everyone.
Thank you very much.
So much, Emma. Thanks.